Welcome to C&P Exam Prep. Going into a compensation and pension exam for your back can feel pretty overwhelming. That's exactly why we're here, to walk you through the Lumbosacral Spine exam step by step. Our goal is to really break down the process so you can walk in feeling confident and prepared.
So, here's what we're going to cover. We'll kick things off with the basics of what the exam actually is. Then we'll get into a little bit of simple anatomy, cover how to prepare your evidence, and talk about what to expect during the exam itself. We'll wrap it all up with some key advice on your mindset. Let's dive in.
All right, first things first, what exactly is this exam? It's a really important piece of your disability claim, so understanding its purpose is the absolute best place to start.
Well, the examiner is going to be using a specific form, and that form is called the Disability Benefits Questionnaire, or DBQ. You can just think of it as their guide for the entire exam. It's a standard form that makes sure they cover all the necessary information about your condition in a consistent way.
And just to give you a heads up, the DBQ for the lumbosacral spine, that's your lower back, is pretty detailed. It's about 14 pages long. So you should plan for the exam itself to take somewhere around an hour to maybe an hour and a half.
Okay, listen up, because this is probably the single most important thing to remember. The entire point of this exam is to document what your life is like on a bad day. Even if you happen to feel okay during your appointment, you have to be able to describe how your back affects you when it's at its absolute worst. That's what really helps the VA understand the true impact of your condition on your life.
Now, to have a really good conversation with the examiner, it helps to know just a little bit about the anatomy of your lower back. Don't worry, we're going to keep it super simple, just the basics you need to know. So, when we say lumbosacral spine, we're really just talking about your lower back. If you look at this picture, you can see the 5 bones, or vertebrae, labeled L1 all the way down to L5, and then the sacrum at the bottom. And those little cushions in between, those are your discs.
Wait, everyone needs to understand something first. While the VA rating system often references the thoracolumbar spine, in the clinic, we most often refer to the lower back as the lumbosacral spine. Here's the difference. The thoracolumbar spine is the thoracic spine and the lumbar spine. The lumbosacral spine includes the lumbar spine and the sacrum. For VA disability, they combine the thoracic, lumbar, and sacral spine into one segment, meaning one rating for the lower spine. The cervical spine is a separate segment. Got it?
Now here's a key point. The nerves that control your legs and your feet actually branch out from this area in your lower back, and that's why a back problem can cause symptoms way down in other parts of your body. You might feel pain, numbness, or that pins and needles feeling down your leg. That's what people often call sciatica.
You might also hear the term intervertebral disc syndrome, or IVDS. The VA basically defines this as a group of symptoms that pop up when a disc problem, like a herniation, starts pressing on or irritating a nerve root right next to it. It usually includes that combo of back pain and sciatica we just mentioned.
This is another term that the VA rating system uses that is not used in the clinic these days. IVDS is specifically for VA disability.
Okay, now we're getting to the part that you have direct control over, preparing your evidence. Honestly, putting in this work before your exam can make a huge difference.
So the big question is, what does that preparation actually look like? What kind of evidence is the most helpful for that examiner to see before you even walk through the door?
Here's your game plan. Get all of your relevant medical records together and submit them to the VA Evidence Intake Center way ahead of your exam. This should include things like your personal statement describing your symptoms, any X-ray or MRI reports, nerve study results if you've had them, and of course, your physical therapy records.
And here are 2 really important tips. First, be proactive. Get your private medical records yourself. Don't just assume the VA is going to be able to track them all down for you. And second, and I'm going to say it again because it's that important, remember that bad day rule. If you show up and you're having a good day, that's fine, but you still have to describe how your back limits you when it is at its worst.
Okay, let's fast forward to the day of the exam. The first part is just going to be a conversation. The examiner is going to ask you a whole series of questions about your medical history.
Be ready to tell your story. They're going to want to know how your back problems started, what your symptoms are like today, and exactly how it impacts your ability to work. You'll also need to talk about flare-ups, any medications or surgeries you've had, and whether you use things like a cane or a back brace. Having this stuff clear in your head or even written down on a piece of paper can be a huge help.
All right, after you've discussed your history, the examiner will move on to the physical examination. Let's walk through the different parts so there are no surprises.
The physical exam follows a pretty logical flow. First, the examiner will just look at your back. Then they'll likely press on the muscles to check for spasms. After that, they'll test the strength in your legs and check your reflexes and sensation. They'll also probably do a straight leg test, and, this is a big one, they're going to measure your range of motion.
So how do they measure your range of motion? Well, they use a special tool that kind of looks like a protractor from school. It's called a goniometer, and it lets them get a really accurate measurement, in degrees, of just how far you can move your spine.
They're going to ask you to do several different movements. This will include bending forward as far as you can, that's called flexion, and bending backward, which is extension. They'll also measure how far you can bend from side to side, which is called lateral flexion.
You'll also be asked to twist at your waist, which measures rotation. And, as we mentioned, you'll likely do a straight leg test. That's where you lie on your back and the examiner gently lifts your straightened leg to see if it causes any nerve irritation. Now, this is so important. When you're doing these range of motion tests, the very moment you start to feel pain, you have to speak up. Say, "That hurts." Don't try to be tough and just push through it silently. The examiner needs to know the exact point where the pain begins, because that's what they record.
Whew, we have covered a lot. For this last section, let's just talk about your mindset as you head into the appointment and a few closing thoughts.
I think this is a really powerful way to think about it. You're not going there to get treatment or to meet a new doctor for your ongoing care. You are there for one simple reason: to accurately and honestly tell the story of your back condition and how it affects your day-to-day life. So, if we boil it all down, it comes to this: be respectful, be honest, and be prepared. By taking the time to understand this process, you are really empowering yourself to tell your story effectively.
Okay, so let's talk about VA ratings for the lower back. If you're a veteran dealing with back pain, you already know it can be a really confusing and frustrating process. But here's the thing. There are actually 3 completely different ways the VA might look at your condition, and knowing which one applies to you can change everything. So let's dive in and break it all down. All right, right off the bat, here's something you've got to know that might surprise you. For VA purposes, your mid-back and your lower back aren't seen as 2 separate things. Nope, they're actually lumped together into one single unit. Now, this is a really big deal because it means one formula is used for this whole area, which is probably not how your own doctor thinks about it.
Yes. The VA combines the thoracic, lumbar, and sacrum into one spinal segment for rating purposes. This means conditions affecting this area of the spine get a single rating.
Here's how we're going to tackle this. First, we'll look at the main formula, which is all about range of motion. Then we'll get into a couple of special cases for very specific conditions. After that, we'll cover what happens when that pain starts shooting down your legs.
Okay, first up, the general formula. This is the most common path the VA uses, and it's probably the one you'll encounter if you're dealing with things like chronic back strain, arthritis, or spinal stenosis. It all really boils down to one simple question: how well can you move?
So you might be wondering, okay, my back is stiff and it hurts when I move, but how does that actually become a percentage, a disability rating? Well, it's not just a guess. It's actually a very precise, very objective process of measurement.
And it all starts with this tool right here. This is called a goniometer. Think of it like a protractor for your body. During your compensation and pension exam, the examiner will use this to get the exact angle of your movement. They're going to have you do a few things like bend forward, which is called flexion, and then bend side to side, which is lateral flexion. What they're looking for is that exact point where you have to stop, where the pain or the stiffness just says, nope, that's it. And they'll write down that precise degree. And here, this is where the magic happens. This is how those numbers become a rating. You can see it clear as day on this chart. The less you're able to bend forward, the higher your rating is going to be. I mean, if you can only get to 30 degrees or less, boom, that's a 40% rating right there.
But hold on, it's not just about bending forward. The VA also looks at the whole picture, your total range of motion. They add up all the movements, forward, back, twisting, side to side, to get a total score. And even if your forward bend isn't too bad, if your overall movement is really limited, that can still get you a 10% or even a 20% rating.
Okay, so that's the general formula. Let's get into these 2 special cases. For a condition called intervertebral disc syndrome, or IVDS, they are literally counting the number of weeks you've had to spend on doctor-prescribed bed rest. It's a whole different ballgame. So, what is this IVDS exactly? Well, it's the VA's official term for a disc problem, like a herniated disc, that's giving you that classic 1-2 punch. Serious back pain combined with that radiating nerve pain that shoots down your leg. You know the one? Sciatica. Now, you need to listen closely here, because this is absolutely critical. Not every bad back day is an incapacitating episode in the VA's eyes. For it to count, it has to meet 3 conditions. You've got acute symptoms, you're getting treatment from a doctor, and this is the most important part. That doctor has to specifically prescribe bed rest. And look how that plays out. The rating is based on how many total weeks you've been on that prescribed bed rest over the last year. They just add it all up. And if you've been laid up for a total of 6 weeks or more, that could lead to a 60% rating. The other special case is a condition called ankylosing spondylitis. This is a severe form of arthritis where the bones in your spine can actually fuse together. And when that happens, the rating all comes down to the position your spine is frozen in. If it's fixed in a mostly straight or favorable position, it's a 40% rating. But if it fuses in a bent, unfavorable position, that rating jumps up to 50%. So we've talked about stiffness, we've talked about flare-ups, but we all know that back problems rarely just stay in the back, right? So what about that pain, that numbness, or that weakness that travels down into your legs? Well, believe it or not, that's a whole other piece of the puzzle. The official name for this is radiculopathy. It's just a fancy term for a pinched nerve, right where it leaves your spine. Sciatica is the most common example. And here is the single most important thing to know about this. The VA rates radiculopathy completely separately from your main back condition. And just take a look at how significant these separate ratings can be. We're just using the sciatic nerve as an example, but depending on how severe your symptoms are, like muscle weakness or foot drop, the rating can go from a mild 10% all the way up to a staggering 80%. And that's just for the nerve issue. So let's just nail this down. First, your nerve problems are not bundled into your back rating. They are their own thing. Second, you get an individual rating for every single nerve that's affected. So if you have sciatica in your right leg and a different nerve issue in your left, that could mean 2 separate ratings on top of your rating for your back.
Like this video if it helped you. Hit subscribe for more disability exam prep content. Send this to a veteran who has a CNP exam coming up. Check out valorforvet.com for more resources. See how the team of medical experts at Valor for Vet may be able to help with your VA disability claim.